Hello everybody, this is Dr. Bob DiMaria and I want to welcome you once again to our monthly Facebook Live with each other. Probably one of my favorite topics I'm going to talk about, except of course my wife Debbie, which we wrote that wonderful book, Dr. Bob's Guide to a Healthy Marriage. But tonight we're going to talk about the liver. And you're going to say, Dr. Bob, why are you always talking about the liver? Because the liver is so important. Give me some thumbs up and some hearts along the way, because the liver is exchanged as the organ of love in China. In America, we use the heart, but the Chinese and traditional Chinese medicine, they tend to use the liver. So let's just get right down to it. It has been estimated that the liver has over 500 functions. But you want to know something from my experience? I don't think we will ever really know how important the liver is. And it's so important today because we are exposed to so many toxins. You know, the air you breathe, the water you drink, the food you eat, the chemicals that you put on your skin or you ingest in your body have to be neutralized. And guess what organ does it? You got it. It's the liver. So think about that the next time that you put something in and on your body. Is it placing an additional demand on your liver? So this happens to be a very significant model of the liver. This is what a liver looks like normally. Nice tissue. This is what a fatty liver would look like, which is probably one of the more common challenges that we're seeing in our practice right now. And this happens to be a fibrotic liver or cirrhosis of the liver. Hepatitis could impact that, but I know alcohol has a major impact. So the liver has many functions, but I want to make it really simple about what we're seeing in our practice. The liver happens to make bile. Bile is the dish detergent in your body. The bile is stored in your gallbladder, and your gallbladder is right here. So every time that you eat some kind of fatty food, your gallbladder excretes extra bile. It emulsifies the fat. It helps break fat down. What I've seen from my experience, after ladies have baby number 2, they tend to have more liver challenges and even gallbladder dysfunction because the babies place an additional demand on the liver and the gallbladder mechanism. If there's anybody watching me right now, anywhere in the world, and you've had your gallbladder out, you really want to contact us because there's a protocol that you'd be wise to follow. What I have found from my experience, individuals who had the gallbladder out and they don't work on reversing some of the challenge going on inside of the liver gallbladder mechanism tend to have fibroids, tend to have heart issues, and even potentially could have cancer. Now, let's just talk a little bit more about this non-alcoholic fatty liver. What we're seeing in the practice, and we've been seeing this the last 6 or 7 years because we have very advanced digital radiograph technology. In other words, when you make that wise decision to come to visit us anywhere in the world, and we take films of your spine and your pelvis, if you have an enlarged liver, we will see it. I mean, it is obvious. Your liver should end right about what the last rib is inside of your body. But what we have seen probably 80 to 85% of the time, most people's livers extend down into their pelvis. Now, we have talked about this in the past. We talk about fruit. I want you to know I have nothing against fruit, but I have also noticed that people just love to eat sweet fruit. So we actually found an article from the American Heart Association, and in it, they even talked about sweet fruit, fructose, impacting negatively the liver function. We also know that fruit can cause extra yeast to grow inside of your abdomen, inside of your large and small intestine, which in turn places an additional demand on your liver. So if you have a non-alcoholic liver, or you've been told you have a non-alcoholic liver, and you don't know what to do, and you eat fruit on a regular basis, I'd back off the fruit. Just do it for a month or two. You can say, why am I doing that for, Dr. Bob? Because fruit tends to place an additional demand on your liver. Fructose, high fructose corn syrup. See, your liver has to work with that. So let's just switch gears just a little bit. How do you know if your liver is compromised at all? So let's just say that you have varicose veins, spider veins, or hemorrhoids. Those are typical body signals of someone whose liver is being compromised. You see, the blood flows up through your legs, through your liver, on the way to your heart. But if your liver is compromised for whatever reason, those blood vessels are backed up. So what I want you to see is there's something in your liver called the inferior vena cava. That'll be a test question, by the way. So the blood flows up and through your liver, through the inferior vena cava, and it goes up to your heart. Now, if your liver is compromised for whatever reason at all, what's going to happen, you're going to have a greater chance to have varicose veins, spider veins, hemorrhoids. Now, those are body signals for a typical a liver issue. You may notice that you have the beginning of red spots on your body. We call those chair hemangiomas. That's, again, a body signal that your liver might not be functioning at 100%. Ladies, you may have tender breasts and heavy menses. Now, we could talk about a variety of different challenges right now, but just briefly I want to point out this happens to be some female organs. We have the vagina, we have the uterus, we have ovaries. What we typically will see is that we will see possibly a fibroid type of tumor in a woman's uterus area because they come into the office, they've been told by their gynecologist they have heavy menses and heavy flowing and tender breasts, that they have a fibroid. That's from too much estrogen. So another body signal for a liver that's not functioning optimally is tender breast, heavy menses, which may result in time to having an ablation. And if you can avoid having an ablation, it would be really wise. A couple other thoughts about this whole liver gallbladder mechanism. Typically, oftentimes, we'll see right shoulder pain, even right knee pain when you have a liver gallbladder challenge, because there's a gallbladder point along the right knee that when that gallbladder meridian from traditional Chinese medicine is being irritated or challenged, you could have right knee pain. You may have metal taste in your mouth when you have liver gallbladder distress. Also, this is very interesting, radishes. I eat 2 radishes every day. Radishes are bitter herbs. So bitter herbs place a huge demand on the liver gallbladder mechanism. And so I eat the radishes every day because I'm constantly working at my whole liver gallbladder functioning optimally. And I think that's really important. So I would suggest to all of you that are watching right now that you might want to add some radishes to your life. But I'm going to share 3 of my favorite foods when it comes to helping the liver gallbladder mechanism out. Number 1 is the apple. I want you to eat at least a half a red apple every day. Apples have a part of the whole system that they're going to help thin bile. That's really important, by the way. There's a blood test, just write this down for me. It's called bilirubin. If your bilirubin is elevated on your blood test, do you ever wonder where they come up with all these names? If your bilirubin is elevated and it is thick and pasty, it's a body signal of thick and pasty bile potentially, you want to start eating that half a red apple every day. So that's important. Now, we talk about beets a lot, but I want to show you something that's been pretty cool that Debbie and I have been doing. Instead of baking the beets, instead of peeling them and cutting them up, I'm going to simply show you this right now. Get your peeler, peel the beet, put it on your salad. You could peel a whole beet on your salad, and what that's going to do is that's going to give you a whole other essence and flavor. So if you have any questions right now, you can send them off to Facebook, and we'll do our very best to answer them. And if we don't answer them now, we'll answer them on the Ask Dr. Bob later on. So we'll be posting this. Now, we happen to be at a location where we've been able to find some heirloom carrots. These are like the best carrots I've ever tasted. Look inside of those. I've been eating 2 or 3 of these carrots every day. What's really significant about carrots Carrots, if you have a floater, so let me back up a little bit. So I eat Dr. Bob's ABCs every day. Half red apple, third cup of beet fiber, and a medium carrot. What I want to say out there is some of you may have little floaters in front of your eyes. And if any of you have little floaters in front of your eyes, throw me some thumbs up or some smiles along the way, because it is very common. I want to share this thought with you. If your floaters are caused by a vitamin A deficiency, I can tell you right now that if you have these floaters in front of your eyes and you eat a medium carrot every day, over time, 6 months or so, those floaters will be going away. So we call that the Dr. Bob's ABCs. A half red apple every day, third cup of beet fiber, medium carrot. I don't want you, I'm going to repeat this, I don't want you to juice this. I want you to eat this. And this is going to help improve your bowel movements and your digestion. And it's just a wonderful tip. So I've talked about women with tender breasts and heavy menses, but for the men, if I have men that have large abdomens, those large abdomens usually have a liver issue a part of them. And I want to share something else that we've learned. Because we're taking these spinal pelvic films, your liver, when it enlarges, it actually can shift. So you could have chronic low back pain, chronic pain in your back. I've even seen some failed spinal surgeries because of this increased size of your liver. So what should you do with this, Dr. Bob? I would back off fruit. How much medication are you taking? Are the medications that you're taking one of the side effects liver disease? Drink more water. Eat the Dr. Bob's ABCs every day. A half a red apple, third cup of beet fiber, and a medium carrot. Actually, I cut that up. I put the beets on my salad, but I have that apple and that carrot in my swap bag, which is start with a protein, medium carrot, a few tomatoes, cauliflower, red, yellow, orange bell pepper. You could do a search on me later on for the swap bag. So a lot of wonderful information I want you to pass on. Next month, we're going to be talking about andropause and menopause. That means we're going to be pressing the pause button, and it's just a part of the book, Dr. Bob's Guide to a Healthy Marriage. And of course, my wife, Debbie, is a part of all that. Thank you so much. We'll see you next month.